couple of minutes and we'll get started here. I see some names that I recognize. Hi, Donna. Hey, Michael. Hey, Dana. Hey, Brett. All of our humans.
Hi.
We're going to get started here in just a second, but we are live streaming on YouTube. So if you have any friends who aren't able to join the Zoom, you can send them the link in the chat and let them know that we're, I guess this is the true definition of simulcast. We can officially, yeah, we can officially use the term simulcast, which is and I'm very excited about. Hi to everyone who just joined. We're going to get started in just a minute. So excited to see everyone here. I think we're going to have about 10 or 15 people joining. So we're going to wait just one more moment before we get started.
Everyone's early. It's not even 3 yet.
I know. The whole world changed yesterday. So I think everyone's shoulders
feeling energized.
Hi, Angie.
Hi, how are you? What's going on, Rachel? You look wonderful.
Likewise, you look radiant. Happy New Year.
Thank you, thank you, thank you. Just hanging out in my house.
All of us, although I got this really beautiful plant, so it makes me feel like I'm in an oasis.
I like that. Oh, look, Mr. Dana, how are you?
Hi. Fine, I'll turn on my video for Angie.
We want to see your handsome face, Mr. Dana. Come on now.
It looks like we've both been growing out our hair. It looks so good.
There's my friend Jamie Griffin. Hey, Jamie.
Thank you for the
invite. He's our consultant from Dallas.
Thank you for the invite.
Wow, so we have folks all across the country. This is great. I'm seeing a lot of folks entering now. So we will get started in just a minute. I'm going to hit the accept button on all these humans. If you are just tuning in, we are simulcasting this event. So we are on YouTube live right now. We wanted to try out offering a different platform for folks who maybe weren't able to join today. Maybe they're on their phones running between restaurants. YouTube's a great place to just live stream if you want to just listen in. So if you have any buddies who might be interested in learning more about what we're seeing in the hygiene training space, the safety training space, we welcome you to share that link out to folks. And then I see some folks saying hello in the chat. Hello to all of you. This is a live chat, so please feel welcome as we're chatting. I guess we're getting started, Christine. I'll introduce myself in a minute, but please, as we are talking today, please use the chat. The chat is for you. It's an opportunity to toss questions our way. You can direct them at myself, at Christine, at both of us, at the hygiene gods, wherever they are, whatever you want. The chat is for you. So we welcome any questions, and we're also going to have a Q&A at the end for a few minutes. So if no pressure at all, but I will be making sure that we're bringing your questions to the surface as we're chatting today. And then we're also going to be admitting people throughout the hour. So if you need to run, grab a cup of coffee and come back, don't worry, we'll hold your place. We're pretty low key here for fireside chats, which is why I love them. So we'll get started. Hello to Jeremy who just joined. Welcome to the very first fireside chat for Opus training of 2021. Very excited to see some new faces, some not new faces. I won't say old. It is a fresh start to the new year. And while we have a big, long year ahead of us. There's a lot to learn, and there's a lot of innovation going on in the food industry right now. And we want to use this time as an opportunity to share with you some of the insights that we've gathered in our space, what we're seeing. We talk to hundreds of restaurant groups every day, and wanted to share with you my good friend, Christine, who is also a partner of Opus Training. My name's Rachael Nemeth. I'm the CEO and co-founder of Opus Training. We are on an absurdly ambitious mission to build the most accessible training platform for frontline teams on the planet. So no small task. And as a part of that, we're starting with text message based training, or training that's delivered over text message, specifically to folks in the food industry. That's my background. I used to work at Union Square Hospitality Group with Angie, who's here today. And before that, ran several bakeries in the New York City area. So well-versed in the food industry. I got out, but not all the way out. I came back and decided to come in a different form. So very excited to welcome you all here today. And we're going to be talking about hygiene training and safety training. Now, we're going to be gearing a lot of this toward the food industry, but we also have some folks here that are in the facility space, folks who are in corporate catering. This webinar is for you too. Frontline teams are up and down the supply chain. So we welcome any and all questions that you have. If you're just tuning in, toss any questions into the chat that you may have for Christine, for myself, for the world. We have a lot of experts on this call, so we might toss some questions out to you too. I see Abhinav is here from Bicky. Bicky offers direct services for restaurants to help them take back their data and retain customers. I'm seeing Dana here from Meesbox, one of my very dear friends who is also in the training space, helping restaurant workers. So lots of really awesome people here on this call, and a lot of folks we're glad to see here. Christine, hello, who are you?
Well, first of all, I'm just so grateful to be here. This is such a wonderful group, and it's such an honor to get to be in this alongside you, Rachael, and thanks again for having me and everyone for joining. My name is Christine Schindler. I'm the co-founder and CEO of Pathspot, and I know a lot of us have thought a lot about hygiene and specifically hand washing in the past year. And I joke that our team has been obsessed with hand washing for the last 3 years, ever since we started and launched a hand washing tool to help with hygiene training in food service environments and beyond, with a simple scan and data platform to help encourage appropriate hand washing frequency and efficacy across establishments. So I won't get in too in depth, but I'm really excited to share more about what we're working on and some of the things that Rachael and I have been chatting about every day.
Thanks, Christine. If you all hear fire sirens, it's because I live next to a fire station. So welcome to New York. Christine, I would love for you to start a little bit. Let's, before we get into the weeds, tell me about your background. How did you get into this space, this really interesting space around hand hygiene and public health with the intersection of the food industry?
So my background's actually in biomedical engineering, and I started working in the healthcare space. So I studied both the intersection of biomedical engineering and global and public health. And I actually started my career living and working in the developing world, where I was building low-cost medical tools and technologies for obviously very resource-constricted settings, mostly in the Kilimanjaro region around Tanzania. And in these hospital settings, we had to constantly think about how to reinvent the way healthcare products operated to make them incredibly low cost, to make them really accessible, to make them really durable. And when I returned back to the United States, I started to see all of these public health issues here domestically that I felt like could also really benefit from low cost but medical grade tools and technologies that right now were incredibly expensive and pretty much stuck up in the healthcare space. And my whole research had been, and all my work had been around how to create really low cost cancer detection tools, specifically screening for breast and cervical cancer, and changing that from being something that was a $100,000 product to something that you could build for $2. And I started to see these other public health issues. And one of them at the time was this huge issue of foodborne illness. I mean, it felt like every time you turned on the TV, people were getting incredibly sick, hospitalizations, even deaths, from these massive foodborne illness outbreaks that were also costing businesses sometimes billions of dollars. And when I started looking deeper into that, and what was actually causing those outbreaks, turns out that 89% of the time in a restaurant, it was coming directly from hand washing practices. And I felt like it was insane that our best practice solution were these signs we all knew, employees must wash hands before returning to work. And I felt like as a biomedical engineer, there had to be a technical solution. And truly at the time, I was just iterating algorithms in my apartment bathroom, trying to isolate the core contaminants that were causing these massive outbreaks. And I was working full-time in the healthcare space. But once I started to see where these core contaminants were coming and isolating those, I just started spending my nights and weekends going out to restaurants and asking people what they thought of something that could actually check and monitor and enforce and sponsor hand washing behavior. And I would just get up at 6 a.m. and knock on doors till midnight and explain what I was doing. At the time, I literally had a bunch of wires taped to a dinner plate. And when everyone told me, I've been waiting 10 years for something like this to exist, I quit my job and sold my car and bought a 3D printer and started building it. So we obviously don't make them with 3D printers anymore, but that's kind of the story of my transition from healthcare into hospitality. And I'm so grateful for the perspectives of people like everyone on this call and helping us to develop our product into something that is as impactful as possible for the restaurant industry.
Your story is wild and perfect all at the same time. Like the amount of stars that had to have aligned in order for you to be where you are today are really incredible. And I think this might be a really good segue into our first opening question about this industry that we all love and have a complicated relationship with many times. And this is actually a question for everyone. So anyone who is on Zoom right now, who is on the chat, I would encourage you to toss your answer into the chat too. I think this is a really interesting question, especially since we have a lot of folks in facilities, which I know touches the food industry too. I see Harmony from New York Building Services. They are doing all of the hygiene, the cleaning and sanitation for restaurants in the tri-state area. So everyone should be submitting their answers if you feel open to it. Hi, Harmony. But here's the question. And then once you toss your questions and your answers in there, Christine's going to give her perspective. Think about the state of the food industry and please tell us in 3 words or less, what is the state of the food industry right now? How would you describe it? It could be a short phrase. It could be 3 key words. I know I'm a linguist, so I'm going to force all of you to think about language right now. But any thoughts that you have around the state of the current food and hospitality industry, how would you describe it to someone who's not in the industry right now? It could be positive, negative, neutral, stretched, hibernating, anxious, rich with opportunity, frustrated, defeated, broken, in need of change. Yeah. Hi, Kim. How are you? Nice to see you. Hi, Stephen. Barrett, trying to survive. Unstable optimism. Hi, Laura. Laura's at the well. Yeah, there's a lot of imbalance right now, but a lot of hope, hopeful for the future, cautiously optimistic. Thank you, Jamie. Good and bad. Thank you, Abhinav. Only after yesterday, yes. I did see a lot of really interesting articles on the Restaurant News website today. Christine, please feel free to keep, hey Joe, prepped for change. Yeah, that's a lot of what we're going to be talking about. How is the industry different now? What do we need to be ready for? PPP, that is not 3 words, Abhinav, but okay, we'll accept it.
3 letters.
Christine, if you had to describe the state of the food industry right now, how would you talk about it?
Yeah, I thought about this question when you were posing it to me earlier and kind of came up with 3 separate words. I think essential really stands out to me. And I know that we're all in that classification, and us as well, you know, building hygiene tools, but it's definitely been inspiring to feel, and then goes into my second word, united with other essential businesses right now from the food service industry and beyond, as it kind of intersects with healthcare and education and all these areas that are so critically important, which I've found to be really motivating during this time. And I think something that Rachel and I are going to talk a lot about today, that is another word that I've seen so much and am so inspired by the partners that we get the opportunity to work with every day, is innovative. I see every single day the industry trying to come up with new ways to tackle these challenges and problems, and not losing steam in that, and coming to us with ideas on how we can continue to improve and serve them, and asking for advice on what more they can be doing, and how to support all the different components that are so critical in that essential piece. And so those 3 words really, I think, embody some of the optimistic pieces that I've also seen in the opportunity that we have to work with our partners.
Thank you. Yeah, it's tough to stay optimistic these days, but I think we also continue to see, I know everyone on this call, some really interesting innovation that is really forcing the industry in positive ways, but more importantly, I think, is forcing vendors to be very thoughtful about how we are delivering our services and our goods, and making sure that we are any product that we're developing, any service that we're providing, that our customers are able to really optimize their use of that. I think it's interesting what you're doing, Christine, because you have, I want to go and talk about your technology briefly. And then after that, I want to talk about biotech and the food industry, and how you're seeing SOPs change across the industry now, especially with new laws, some of which I just learned about on this call today as somebody who thought she knew every law. So we'll talk about that. So tell us a little bit about Pathspot and what exactly it does, and then we'll go from there.
Absolutely. So kind of, I guess, picking up on the from where my story left off, when we got to a stage with Pathspot that we were asking, you know, what can we build, and what could we really do to help solve this gap in hand washing? We realized that the 2 pieces, I guess, that we felt were super important in ensuring that all those foodborne illness cases and other illnesses that came through improper hand washing were tied to either hand washing frequency and the number of times we wash our hands, and hand washing efficacy and how long and how well we wash our hands. And so, as I mentioned, you know, we started working on this years before a global pandemic turned the world's focus to hand washing. It's definitely was a little bit surreal when one day, you know, we looked up and every celebrity, every news station was talking about the importance of hand washing and how well you need to wash your hands. But when we really dove into that, what we created is a tool that mounts on the wall next to hand washing sinks in the back of house of restaurants, farms, packaging facilities, cafeterias, really anywhere where food is handled, stored, or served. And right after a team member washes their hands, they put them under the unit, flip them over, and it instantly pops up on a screen. It takes less than 2 seconds, the whole thing, and it just tells them if they have any contamination on their hands that could be responsible for one of these harmful contaminants being present. And it's a totally invisible source of contamination that often cause these massive chances of illness from happening. And it takes less than 2 seconds to actually validate if that's present on your hands. And if you have contaminant, it's no problem. It happens all the time. There's no shame in it. It just pops up on the screen and says, rewash your hands for a full 20 seconds. You know, oftentimes we're all guilty of doing the 5-second quick hand wash. And come back, rescan your hands, and make sure that that contaminant is gone. Then we take all the data from those scans and we give it to management teams, both at a store level and at a corporate level. So you can really understand and look into who's washing their hands and when and how effectively, and use that to ensure that all hand washing procedures and policies are being followed. But more important than that, to really create a positive culture around food safety and sanitation across an establishment. You know, our goal is to use this hygiene tool that is the one thing that everyone across an establishment touches. Everyone is responsible for washing their hands. And it's the one safety thing that really unites the entire staff and team. And we can really create rewards and incentives around that and use it as a kind of beaconing call around safety across the organization. And for some locations, that looks like hand washer of the week, or hand washing location of the month, or rewards for managers that meet and exceed all their hand washing requirements. Or it can be turning it into a game and having fun trivia questions pop up while you're washing your hands, and you only get the answer if you scan correctly. And then using all that information to really create super targeted hand washing training. So instead of the standard, hey, everyone, wash your hands for 20 seconds, it's important, we can say, hey team, here at this location, 98% of the time that someone failed a hand wash, it was on their right pinky finger. We need to make sure we really scan in those areas, wash hard in those areas. Or, hey team, we fell below our hand washing goals during the lunch rush. You know, we're supposed to wash our hands once every hour, and we're not hitting that as a team during that time. We really need to be accountable to that. And then we have interactive games on the screen that actually cycle back to that, filling up a health meter throughout each hour to make sure you hit that hand washing goal, and confetti popping across the screen. We customize those for our different locations. So I'm sure we'll touch on more of those, but our goal across the board is to use this to both ensure that hand washing is being followed, but most importantly, to create this mechanism of sanitation culture across an establishment that everyone can really get behind.
And I would imagine a lot of this, you know, when we think about hand washing, and I remember all of us at the start of COVID were like, great, 20 seconds, do your thing, every 30 minutes, great. But I think what we're seeing now in the industry is that it's much more distributed. Managers are split between 2 and 3, sometimes 7 units now. And so that close supervision is a little bit harder to achieve. And so the question is around compliance, but it's also just around how we can not only support frontline teams, but it sounds like a lot around how you can support sous chefs, GMs, et cetera, who are responsible for that.
Yeah, it's been super inspiring that a lot of times the managers actually share with us how much this makes their life easier. Like right now, a lot of times managers are responsible for checking and making sure people are washing their hands, kind of in the back of their head. Like, so one manager told me I would just yell until people hated the sound of my voice to make sure that they were washing their hands enough. And so the idea that that can go off their plate and they have something that's constantly telling them like, hey, are we hitting our hand washing goals? A lot of managers tell me like, it's like a co-manager, just take something totally off. And it's kind of an awkward topic, I think, for a lot of managers to bring up with their teams. You know, you don't want to sit people down and say, hey, you know, I get a sense that you're not being clean enough. But if a technology product is saying that, you know, it's a little bit easier to use that as a tool to create that accountability. And what we hear when we shadow our locations is team members really just shouting out, hey, why are we in red? We should be washing our hands more. And right now, especially, I'm seeing that so many teams, you know, they want to know that the other people around them are safe. There's a huge accountability measure right now because everyone has to be within 6 feet of each other in those cramped environments. And it's really critical that all the team members can feel like everyone is protecting each other, and having a tool that just helps to automate that so that everyone can be in on it and then be celebrated and rewarded for hitting those goals around hygiene together. That's really what we try to do to create that back of house culture.
So I want to come back to the notion of culture. Before we go there, I'd really love to hear a little bit more. We have some multi-state operators here. I know, at least on the training side, there have been a lot of new, very unclear laws, regulations that are coming from local governments, soon the federal government, around COVID safety, right? We found that 40 state governor's offices have required that employers train their teams in COVID safety. And it was scary because a lot of folks didn't know that. And so I think it might be helpful for this group. You're our expert here on hand hygiene and food safety. What are some of the laws that folks should be knowing about that might be state specific? I know we have some folks here from Texas, Florida, et cetera.
Yeah, it's a great question. And I totally agree with you that a lot of the way that these laws are presented or enforced can be so dynamic and a little bit unpredictable or vague, even in its form. We're really committed to working with lawmakers and local governments to understand and make sure that our product is helping to meet all requirements when it comes to hand washing and hand washing trainings. A lot of what's coming through is, a requirement for a certain number of hand washes per employee per hour. And that varies based on local or state, but most of the time it's either 30 every 30 minutes or once every hour that each team member can be mandated to wash their hands and required to. And that the way that that's being enforced right now, a lot of it is with employees coming back and saying, hey, for my own safety, everyone should be washing their hands every 30 minutes. And I'm not seeing that from the other staff. And now I feel uncomfortable. It's similar to what was happening with the Amazon walkouts at their facilities, right? The employees found that law and said, I don't have enough hand washing breaks. I'm not given the opportunity to wash my hands enough, and neither are the other team members, and that puts me at risk. So a lot of these laws are shaping or coming into fruition because of that. And right now it's hard for the government bodies to even think through how they're going to encourage those different policies. And one of the things that has been being talked a lot about at a local level is requiring there to be a staff member present, actually checking number of hand washes as a part or full-time responsibility. And truly, like, the way they're presenting it right now is a checkbox of like, I saw every employee wash their hands every 30 minutes to ensure that that's happening. That's a ton of labor costs. So one of the things that we're really working with is how do we make sure that our product meets all requirements for that? So you would be able to opt to use a technology-based solution like ours instead of human capital of having someone stand there and check their hands and make sure that everyone's washing. And so we've built our product to be able to be adapted for all those different local regulations and what the changes might be required. And we're very well versed in them. So when a team member comes to us and says, hey, I've got a location in this location and this location and this location, we work with them to make sure that the product is tracking towards the right number of hand washes and backs back up to those policies, both at an individual store level. Some stores have that already built out, or we help them and then go through a process of building that with them with targeted CSM managers that know how these restrictions and things are going to be put into place. And then we communicate that to the team in the trainings. What is the science behind why you have to wash your hands once an hour? And how is that keeping you safe, keeping customers safe, and making sure that you're in a position where you're going to be as safe as possible going back to your families? Like, that's what's so important to us about our product. And what is the most important thing for me is when I hear from people who use our tool that they feel safer coming back to work because they have this, because it helps keep them and the team accountable, because they can tell their families that may or may not be immunocompromised, I know my hands are clean and I know everyone around me hands are cleaned. And there's so much education that's been done about how transmission vectors of illness are spread. And I think that it's really powerful that employees are taking accountability on that. And we want to be a tool that helps to bridge all those gaps. So there doesn't have to be a labor force involved with checking hand washing.
You know, you're bringing up a thought here, which is around what was happening, and Stephen Picker brought this up. Hi, Stephen. Around what, and Stephen, I'm going to rephrase your question a little bit, but we didn't see this pre-pandemic, right? So how much of this is going to stick? I think that's a question a lot of people have. In 6 months, the hope is that a vaccine is well distributed. So are we going to see these regulations disappear? Are we going to see a permanent change in a lot of these practices? So that's the first piece of this. And the second piece is a lot of what you're speaking to is around COVID. And why COVID kind of locked this in place. Do we feel like maybe it's going to stick, but stick more on the food safety in that angle? I'm curious to hear your thoughts.
Yeah, absolutely. You know, I think about this a lot, especially because of that education piece that I mentioned. You know, I'll be honest with everyone on this call. I used to get on the phone, and as I mentioned, started this 3 years ago, with executives in the industry, and they would be like, 20 seconds is a long time to wash your hands. I don't believe you. And I would say, no, you really need to wash your hands for 20 seconds. That's what the CDC recommends. And everyone would be like, yes, I don't believe in 20 seconds. Who told you that? And now, you know, there's not a person in America who doesn't know 20 seconds. Every celebrity stood up there and said 20 seconds. People do know and are way more educated on the transmission vectors of all illnesses, you know, COVID-19 included, but the flu, E. coli, salmonella, neurovirus, hepatitis A, listeria, colds, all of that is the same thing transmitted through hand washing. The difference is now everyone knows and stared at for a year those hand washing facts. And so what I really hear from teams is, because of that education, you know, people both at a consumer level and at an employee level are going to remain hypervigilant. You know, you're not just going to forget the importance of these different health and safety mechanisms. In fact, I think those things are here to stay. And I feel, you know, very motivated and optimistic in that, because think of the illnesses we could prevent in the future because we have this awareness, because this incredibly unfortunate global pandemic exposed and educated us to how illness is transmitted across so many different areas and regions. And I think that's not something that's going to be forgotten. You know, we're seeing Yelp reviews of people saying, I saw someone only wash their hands for 5 seconds and I know that doesn't count. And we're seeing employees go to their managers and say, I feel uncomfortable because this other team member only washed their hands for 5 seconds and I know that doesn't count. And I think that people are going to be looking for indicators to ensure that that's upheld across the board. And I do feel really optimistic about that too, because, you know, we already had been growing traction prior to COVID-19 with this tool. I think that food safety operators knew the importance of this and were struggling to get buy-in from other departments. And now, you know, everyone gets it. The hand washing problem sinks instantly. And I think those stats are going to remain. And I'm hopeful that technologies like ours and so many other hygiene tools and training opportunities will be something that people will be really bought in on and will help us prevent future illnesses as well.
So we have, I want to talk about biotech here. And before we move into that, I had one question for you, and because it sort of relates to how we're partnering right now. You had mentioned something a while back, which is how we met. We met because we were both in the food space, but we both realized that there was
instant friends.
Exactly. There was, if anybody wants to just hang out after the call, we're just going to be talking for the next 4 hours. But there was something that you had spotted around Pathspot, which was that food safety operators, restaurant operators recognized why hand washing was important. They knew that there could be a tool to help monitor that with Pathspot, but you had a lot of frontline teams that had some reticence around using it, and we're kind of new to this notion of scanning, right? We have some HR folks on the call. How do people feel about having their hands scanned by their employer? We are in a world that is very new when it comes to technology and how it intersects with our workforce. How are you thinking about that? How are you solving for it? I guess it's trust factor.
Exactly. And that's part of why I think that we're so excited to be in partnership with you and your team. You know, for us, it's all about training. Anytime I sit down with a team member and explain what the product does and why, and how we aren't collecting any personally identifiable information, how the technology cannot be utilized. It's not a diagnostic tool. It's an indicator of these different contaminants, but it's something that's meant to be rewarding, really working with the brands to ensure that we explain what the product is detecting for and why. And it's so important that those trainings occur, and it's hard to scale that. You know, I can go door to door and sit and talk to every single team member and buy them a coffee and explain what we're doing and why, and those locations are crazy successful. But it is really important that that information gets shared as groups change and there's turnover and things happen in a location, which is why, you know, working with you, Rachel, on making sure that that training is at the front and forefront, and we're explaining what the product does and why. You know, I also found on the flip side of that comment that a lot of people are excited and enthusiastic about new technology when they understand it, you know, when it's been explained, when they get why it's doing what it's doing and how it's truly there to help them. Sure, it's great if we can prevent, you know, outbreaks, that is important. But for us, this is something that helps the culture of each team member and makes them feel safer at work. And that's always been our goal. So when we can put that at the forefront, I think that's super critical to making sure that that positive cultural element is there with any tool like this. And of course, we work with the brands too to make sure, you know, in some locations it's shift-based tracking. So there's no individual information at all. It's just, hey, there's 5 employees on shift, and so we should hit one scan every hour per employee. And then other locations choose to have it be more individualized or even more anonymized. And we can do that anywhere on the scale and even shift it based on different locations and what the needs are in those different rooms and environments. So we try to make it really customizable. And then whatever decision we make alongside the owners or corporate staff of the brand, we really work hard to communicate that and then think through how that training is consistent. And I think one of the things about our partnership that is so motivating to me, Rachel, is also, you know, how we not only explain what the tool does from the beginning, but make sure that the insights from the tool are continuously being utilized and adopted into a location. I think one of the things we hear a lot about hygiene and safety training across the board is it's super easy to forget. And even if you do a hygiene training once a week, the day is really busy, and it's so hard when you can't see these contaminants and you can't smell them and you have no idea that they're there. And the fact that the product that we try to build this into everyday use, and every time you wash your hands, you do a quick scan, and then we take all that information and we're doing constant trainings, you know, through the Opus platform, and being able to use that as a feedback mechanism and loop. It makes it so that people are reminded why they're using it, and then actually getting conversation around that. I love when I hear from managers, like I heard our team talking on their break about how they could better wash their hands, and the fact that contaminant was probably spreading because 3 of them had a failed scan that day. And that might mean that they should rewash the tables because, you know, this infiltrates beyond hand washing. And that's our real goal too, is how do we take something and make it so that people think more about safety across the whole organization, because something in the safety mechanism is hitting them every single time they perform a certain task.
I remember when I was running AIB audits, which is an international audit for bakeries, I remember always being really nervous about employees holding each other accountable, because I didn't want, you know, people can get bossy and, but it actually ended up being, you know, let's be honest, but it actually ended up being really powerful to see, you know, Manny, our head porter, say, hey, I saw that, you know, you walked out of the locker room and you like your shoes weren't tied. I don't know. But all of these ways of helping support folks in being independently accountable to one another and really building a community around that. This brings up the question of customers and training and hygiene. Great. So your employees are doing a great job. How do we think about customers? I know that's been a big topic for a lot of operators right now. What can we do to kind of support a culture, not only within the kitchen, but in the entire stratosphere of our, 50,000 square foot property.
Yeah, absolutely. And I think a lot of it starts with the core team and giving them a tool that they can advocate for and share. A lot of people are telling me that customers are coming in and asking them, what are you doing around safety? What are you doing around hygiene? How are you keeping me safe? And so we really tried to give tools to buy into that and to be able to answer their questions above and beyond. We give stickers and buttons that say my hands are clean, that we put on aprons, and my hand washes are verified, that we put on hats. We put stickers on sneeze guards and on menus and on the front of the door. We work with some of our brands and have actually made custom tablets that count up hand washes throughout the day, so that when you walk in, you see there's been 5,000 hand washes at this location of the day, and the hand washer of the week is Rachael, because she has crushed all the hand washing goals. And then people are coming in and saying, are you Rachael? Way to go on the hand washing. And it's creating this like real dialogue around safety that's easier to talk about than, oh, well, we wash things, and I see a lot of the signs that are put up and it says, we ensure that we wash our hands, but that's not any better than a sign that says employees must wash hands. And it's not something that people can talk about, but this is something where they can point to a unit, they can say, we scan, we check, we're all very sure that our hands are clean. And then we post that on social media with our brands. And it is insane, the results that we've had, and so inspiring to see people commenting on social media posts and saying, I haven't eaten out in months, but tonight I'm taking my kids to Dairy Queen because I see what you're doing and therefore I want to support it. And I love that you're doing something around hand washing and validating that. And I think it just gives a real dialogue piece for team members to speak about to their families and friends. And of course, we work with brands, and some brands don't want to share it out with customers. They prefer to be an internal tool, and we definitely respect that. And that's our primary goal. But for brands that want to share this, we've gotten a ton of press coverage. We've had media come in and do a lot of actual videos of staff members scanning their hands. I can definitely share some of them after this call, but it's a fun topic to really create tangibility around something that, to be honest, until now has been really intangible.
So you're bringing up something when we're thinking about the future of hygiene and hygiene safety training. This is sort of a two-part question. The first that comes to mind is, and this is, I know we're all kind of at the start of a new administration, but I'm curious, do you think we're going to start to see more requirements? We were just talking about things at the local level and really kind of drilling that down. Do you think we're going to start to see more at the federal level? I just saw something in the news today where the Biden administration is really trying to like tighten up and heal that relationship with the CDC and OSHA. How is that going to impact restaurants and hygiene training? What do you think?
Yeah, to be honest with you, I've been really involved in those conversations and trying to figure out how it isn't a labor solution. I think, in the conversations I've been in, a lot of it is, well, we just need more people. We need more people to check. We need more people so that hand washing happens more often. We need more people so that there are more breaks. And from every brand that we work with, that's just not something that's feasible, and it's incredibly expensive. And so I've been really working with how do we create a technology-based method for ensuring that is occurring. And I think it is a real conversation at a federal level as well. And, the CDC and FDA has done studies on hand washing compliance in restaurants. And unfortunately, the results are abysmal. Typically, restaurants fall in these at less than 25% compliance with the rules. And when gloves are included, they typically are at less than 15%, because people actually don't wash their hands even more because they feel safe if they're wearing a glove, but that's a huge risk factor. And I think right now people are looking at that and saying okay, so we put out a study that says, just a few years ago, we put out a study that says that we're at less than 20% compliance with the expectations. And then we haven't done anything to encourage and push back on that. And now everyone's staring at hand washing and hygiene across facilities. How are we actually encouraging those different pieces? And they're really trying to be innovative in the ways that they I think, encourage brands to do that. And, you know, we don't want this to be something that everyone installs because it's mandated. You know, I want to work with the brands we work with and say, how can we make this something that's so useful for you that all this doesn't matter? But then, hey, also, if they do end up coming in and saying, you have all these rules, let's make sure that this product is something that meets and ensures that you are on track for all of those different pieces, not just for the fact of trying to meet the requirements, but also so that your team feels as safe as possible, and so that we can get in front of issues like the Amazon walkouts and many other brands that had similar situations where employees don't feel safe in their hand washing and hygiene. And that there's a real accountability metric that can tie back to that in a positive way.
Is there any difference or anything that you would recommend that folks be aware of when it comes to training managers versus training frontline teams in the hygiene space? Anything, what extra pieces do managers need to know beyond their frontline teams, or is it all level playing field?
Yeah, I think it's the one thing that is the most level, you know, and that's what's so inspiring about getting people to, and obviously you can tell I'm very passionate about hand washing, but really when I look at everything that happens across an establishment, I've interviewed thousands of operators about safety and safety mechanisms. You know, there's this manager does this job and this person does this, and here's how safety fits into all these different roles, and everyone has different expectations, but every single person has to wash their hands, and every single person has to wash their hands the same number of times. And that's something that's really cool when you think about it, like, because we can create this unifying factor around it. Now, of course, from a manager standpoint, there is the added accountability of ensuring that everyone else is doing it, of course, which is, I think, very stressful. And for what I hear from a lot of the teams we work with, also really overwhelming, and something that they tend to want to avoid, because as I mentioned a little bit earlier, no one wants to be the person who has to call someone out for being dirty. It feels more accusatory than, hey, you didn't lock up yesterday and that's your job. Hey, I don't think you washed your hands well enough. People start to get defensive. Yes, I did. Like, what are you saying? Are you saying I'm dirty? Like, are you? And it's awkward, and no one wants to be involved in that. So we try to make a lot of anonymity in that and say, like, hey, you know, I don't know, but I look at this unit and we're not hitting our required numbers. But I think even if you don't have a tool, it's really working with managers to think through how not to skirt those conversations because hygiene's uncomfortable, because that can be really challenging. And there's so many things that are urgent in a minute, and a hand washing probably doesn't feel like one of them, if we're being honest. And you've got a line that's wrapped around, I mean, I think about in the financial district where I work and some of these locations, I mean, the lines are wrapped around the building 5 times, and you're not thinking about, am I taking a break to do a 20-second hand wash right now? But we have to be. And if we don't, the risks are infinitely more high. So I think it's about ensuring that there is space for that, and that it's not something that's stigmatized. It's not something that you can get in trouble for doing. And I've even heard team members tell me that, you know, I got yelled at by my manager because I took a break to wash my hands, and I was really busy, and there was a crazy long line, and I didn't have time to take a break. And that's going to be a bigger issue, I think, in today's world. And so, you know, it's a lot about how do we reduce the stigma around the hygiene piece, and it's not really a hygiene break, right? It's a requirement that is a critical and important part of each team member's job.
You know, you're bringing something up around anonymity that I think is really interesting, and it has changed a lot in the training space, especially around food safety. We're used to these checklists with initials, and we're used to, you know, this like high level of how can I trace this back, which has not gone away, right? It's actually quadrupled in many cases. We're asking guests to sign to tell us that they've come into the restaurant. Vaccinations it's gonna be a whole different world that we're living in, who's vaccinated and who's not. And it's all for public safety, right? It's all for the greater good of humanity. But it comes at a cost too, because to your point, nobody wants to be called out saying like, you didn't wash your hands, but we know that it's important. Is there anything that folks can do, even if they don't have Pathspot, in order to like honor some of that anonymity in their restaurants? What can we do, or is there a solution to track some of these practices early on before we're ready to move to technology?
It's a great question. And we really talk a lot to our teams about this, you know, beyond just using a technology-based platform, but how do you create a positive culture around this? And it's little things. Like I talked to one brand and they sing every time someone washes their hands, they sing. And if someone sees someone washing their hands, they cheer. You know, how do we make this something that is celebrated? Because it is. We're protecting ourselves, we're protecting each other, we're protecting the customers. At the end of the day, you know, that's so critical. If that isn't being upheld and that trust isn't there, then people aren't going to feel safe in their environments, especially now. And so I think it's a lot about, you know, creating rewards around this. And that's why, you know, we can do that with our tool, but even separately, like managers, instead of calling someone out for being dirty, we give away, you know, $5 gift cards to people who are doing a really great job being clean. And we'll call them the hand washing captain or the sanitation captain. And it's little stuff, but I think creating that makes it so that other people want to wash their hands more, want to be thinking about these tools, want to be involved in hygiene. And a lot of the celebration, and not that this is a bad thing to celebrate either, but is around volume of team members that get through or positive reviews, and all that's so important. And just adding in another one that puts hygiene at the top of that pillar, and create something that people can be rewarded for, whether that's in a tangible way or in just a, hey, I see someone washing their hands in the middle of a busy shift. This is something I tell our teams is, if you see someone washing their hands in the middle of a busy shift, like cheer for them, be like, way to go. Like, thanks for making time and reminding all of us that we need to be washing even in the midst of all of this. So I don't know that there's one, you know, only one answer, and it's going to vary. It's why it's so important. And we have dedicated CSMs that focus on hand washing for each different brand that we work with, so that we can understand what their policies are and how we fit into that, and we can build off of whatever their culture already looks like. But I think that, you know, across the board, it's about talking about it as much as possible, creating accountability around it, and rewarding and encouraging it in a minute by minute basis, not in a, hey, we have our monthly hygiene training, everyone sit down and remember how to wash.
I'm just envisioning, if TGI Fridays is listening to this, I'm sorry, but like every restaurant turning into a TGI Fridays where people are just like cheering all the time and drinking blue margaritas. It's a very
oh, because we're washing our hands. Like,
I love that idea. Like it's for the first time in history, it's actually not patronizing to do that, because hand washing is globally, well, in many countries, is like the easiest, simplest thing to do, and actually requires some element of celebration. It's actually pretty interesting how this has changed, and I would imagine if we do it right, it's gonna persist. A culture of like not having to slog through a food safety training because you know it's for the good of check the box anymore, but it's also because you need to take care of yourself and your family, colleagues, and your community. That's what I love about this, is that everyone on this call has done food safety training. I see MJ is here from Drive Change, and like it is so hard to get people on board and engaged with food safety training, because it feels like it's just something you have to slog through, and now it's actually something we have the opportunity to really embrace and make interesting. One of the things I think that we're finding is really in order to not only keep folks compliant, but to keep things interesting, is adding another layer of interest, adding facts, talking about history, talking about why things are the way they are, and bringing dignity back to a lot of the kind of some of the stale information that is still important, right? But that requires a little bit more oomph. And one of the things, it's important. And one of the things that you're doing, which I think is so interesting, is that you're actually, and this is my wrap up question here for you before we get into how you see the future of the world, which is very important. And I want to hear from everybody. It's you have talked about how you have all this really interesting anonymized data at Pathspot. you see what the most common places are that people are not washing their hands. Are there some interesting facts that folks on the call can take away from them today, go back to their restaurants and say, hey, listen, like, of all the restaurants, like the least common place washed in hands is this, and the most common is this?
Absolutely. So exactly that. Like, I think one of the ways you can make things interesting is by presenting new information or targeted information. And so what we'll do with our data is either show it to, at this specific location or across our brand or across every salad location, like what do we see as the common threads in miscontamination areas? And then we take, and there's a ton of resources on our website. In addition to just, giving that to our partners and building customized trainings, we also anonymize all that data, with permission and give it out for people to use in terms of really targeted signage, really specific training materials and tools. And so one of the things that we see a lot of the time is that contamination hides underneath jewelry. And that's part of why, usually jewelry isn't permitted in back of house, but it's magical. It always shows up on our scans and there's contamination all over it or through it, because even if you take jewelry off to wash your hands, your jewelry may be contaminated. Under fingernails is super common. Another area that people forget a lot is wrists. Wrists are a really common source of contaminant, and then you bump your wrist and now suddenly the contaminant is all over your hands again. Unfortunately, gloves, even when they are freshly put on, are a huge source of contaminant that we see across the board. And actually one thing that's really interesting about gloves in general is that a glove is more transmittive of contamination than just a hand. Like if I were to pass my hand here or pass a gloved hand here, gloves transmit more contamination per surface area. But people put on their glove with a dirty hand because they didn't wash their hand fully. And now that glove is spreading contaminant across the location. So those are some like high level trends that we see, and we really work hard once we see spikes in contamination or dips in number of washes to like call it out in the second and either phone the location or call whoever we need to, or send notifications on the unit or to our spokesperson to make sure that it's being accounted for. Because I think that's part of what makes it interesting. Like it's about how do we take this information that's new that we're gathering that hasn't ever been gathered before and actually create backing behind some of these stats that everyone knows, but how much do we really internalize it on a day-to-day basis? So after this, I'm sure everyone's gonna go wash their hands. So make sure you scrub your wrists, under your fingernails, and on and around any jewelry that you may have on.
Also, I keep seeing I checked under my fingernails when you said that. I was like, well, damn.
Well, you just got to scrub.
Your voice is going to be in my head. I've also seen instances we've had chefs call us up and ask about, you mentioned gloves, nitrile gloves, latex gloves, what have you, and folks using hand sanitizer on them or washing the gloves. What should people know about that? This is my last tactical question.
Yeah, to be honest with you, they really should be removed. You should wash your hands and put new gloves on. Honestly, it doesn't matter how well you wash a glove. And we've done crazy tests where we washed a glove for 10 minutes straight and the contaminant still didn't get off, because it gets stuck in all the grains in the gloves. Whereas, to be honest with you, the CDC statement of wash your hands for 20 seconds, you really will get rid of all the contaminant if you wash your hands for a full 20 seconds. It's wild. And it's so funny when we see team members, they wash their hands, they scan, they fail. They what? How could I have contaminant on my hands? They go back, they wash for 20 seconds, they pass. And they're like, oh, now I get it. And we all have fallen into that. I'm sure many times, myself very much included. I feel like I'm in the restroom sometimes washing my hands, especially pre-COVID. And someone would come in, go to the bathroom, come out, fix their hair, fix their makeup, wash their hands, be staring at me like, why is that girl still washing her hands? I'm there doing my hand wash. But it is truly the timing and washing your hands for a full 20 seconds and scrubbing those spots really will get rid of it on your hands, but it won't get rid of it on gloves. So you really should just dispose of gloves or do a full hand wash and not use gloves depending on the operating procedure.
Thank you for indulging my very specific question.
I think a lot about gloves. I know way too much about this. properties of
We have
different.
a whole other conversation about it. We're coming up at time. I want to open this back up to you, Christine, and I want to open it up to the rest of the community here. We have almost 30 people on this webinar from all across the United States, from up and down the food supply chain. I see some folks out in California who have joined, in Texas, our friends here in New York. I would love to hear what everyone's thoughts are on what does the future look like when it comes to hygiene and safety training for our teams. And when I say future, I think we're all very much in the space of 2021. And I think we all have some insight around what that might look like. That we're going to have another 12 months of a lot of fast moving, a lot of changes. What do we think it's going to look like in 2025 or 2030? Christine, I'm going to toss it to you on what where you think the world of food safety is going to be in 2030. And I'm going to encourage everyone to toss their answers into the chat. There is no word limit on this, by the way, so feel free to write a book if you want to, whatever you think. But Christine, what is food safety in 2030 going to look like?
Well, I really think that it looks like a healthier world. I'm super optimistic that because everyone is so much more educated in these different transmission vectors of illness, because all of you are sitting here and engaging in this conversation with us, and we're thinking about these challenges and how we can support each other in them, and because individuals are taking real accountability and knowledge and knowing that they want to create the safest mechanism for themselves and for those around them, I think there's a real spirit of public health right now that I don't think will go away. I think this is going to be a transformative moment for us to bring many tools like this into the industry and other industries so that people are more accountable and that we use it to have a healthier world and be in a better position to fight illnesses like this in the future.
Well said, and I agree.
My 30-second summary. But
it's true though. I agree. I think we have been through a very dark period. It's going to continue to be a challenge to keep up with local, state and federal regulations. It's important. It's something that we in the food tech space in particular take very seriously and are trying very hard to serve folks in the industry, because we know it's so difficult to keep up with. But I do think that there's a light at the end of the tunnel. I think that there's a world in which there's some regularity, some predictability, and just a heightened new awareness around not only the basics of food safety, but I would imagine we're going to start to see better, more easy to comply with regulations. To everyone listening today, thank you so much for joining. This is just the beginning. We really wanted to frame this around the area of food tech and hand washing and just like the fundamentals of food safety and where it's going from Christine's perspective, someone who I deeply respect and admire, who came from public health engineer turned entrepreneur, turned like food safety expert, and so excited to see you here today and to partner with you. Christine, thank you so much for joining us.
Thank you for having me, and I'm so grateful to be in this world with all of you. I really appreciate your thoughts, and please reach out if you have any other questions or ideas for me or for how Rachel and I can continue to work together.
Everyone, if you're interested, this is on YouTube Live. We were live, and so you can share this with friends. Anybody who might want a refresher on safety training, we're going to send this out to y'all. We'll post it on our LinkedIn profile if we don't have your email, so you have it. Thank you all for joining today, and happy January 21st. Not going to say New Year. We'll leave everything up in the chat here. You can follow Christine on LinkedIn. ask her any follow-up questions. Pathspot.com is the website to go to get even more insights on biotechnology. Opus.so is where you can go to learn a little bit more about what we're doing to train frontline teams by leveraging text message. And all y'all very soon are going to learn how Christine and I and our teams are partnering to make food safety training more accessible, more cost effective for everyone in the industry. So stay tuned.
And more fun.
Yes, it's way fun. It is way overdue. All right, everyone. Have a great afternoon.
Thank you, Christine.
Thank you all.